One of the most fabled stories in the annals of public health began inconspicuously when Fred Lowe Soper, a young man from Hutchinson, Kansas, graduated from Rush Medical College at the University of Chicago. Although no one knew it at the time, the days when South Americans lived in fear of malaria and yellow fever were numbered. Young Dr. Soper wasn't all that interested in public health work, but the year was 1918 and economic times were uncertain, so he said yes to the Rockefeller Foundation's International Health Board and the $200 a month salary they offered. Dr. Soper stayed in Chicago for a one-year internship at Cook County Hospital, and in January 1920, he and his new bride Juliet set sail for Brazil and a life that would be linked forevermore with South America. Once in Brazil, Soper organized hookworm campaigns and took control of hookworm programs already in place. But in 1922, the Sopers returned to the U.S. so Fred could attend the Johns Hopkins School of Public Hygiene and Public Health. Having gained the additional knowledge, the Sopers returned to South America in late 1923, where Fred spent the next 4 years administering hookworm control programs in Paraguay while he systematically tested the performance of several available hookworm remedies. The years of hookworm work in Brazil and Paraguay developed Soper's diplomatic skills among local citizens whose trust was needed if the surveys and treatments were to be effective. In 1927, Dr. Soper was transferred to Rio de Janeiro as administrative head of Rockefeller's regional office. There he helped conceive and carry out effective campaigns against yellow fever and malaria. He demonstrated that with proper techniques and meticulous organization, the mosquitoes that carried these diseases could be virtually eradicated. By 1942, Brazil's malaria threat had been all but eliminated, and with World War II underway, the Rockefeller Foundation loaned Dr. Soper to the U.S. War Department, where he became an infectious disease consultant. Joining the U.S. Typhus Commission, he tackled the outbreak of louse-borne typhus fever among civilians and military personnel in North Africa and the Middle East. Between 1943 and 46, Soper, with personnel from the Rockefeller Foundation and the Allied Military Health Services, conducted delousing operations in Egypt, Algeria, and Naples, Italy. In the process, Soper's team developed an efficient, effective, low-cost typhus control protocol using insecticide powders, including something called DDT, which was brand new. During the same period, Soper also worked on malaria control programs in Egypt and Italy. In 1946, Fred Soper was presented one of the first Lasker Awards, recognition of his pre-war campaigns against yellow fever and malaria in South America. After the war, the Rockefeller Foundation made Dr. Soper regional director for Africa and the Middle East. But in 1947, he was elected director of the Pan American Sanitary Bureau, PASB, the executive agency of what came to be known as the Pan American Health Organization. He would head PASB for a dozen years. Dr. Soper was also front and center when the World Health Organization was taking shape, and he succeeded in having PASB designated as the World Health Organization's regional office for the Americas. Between 1949 and 59, PASB programs helped eliminate diseases such as yaws and malaria from many areas of South and Central America. Fred Soper retired from the Pan American Health Organization in 1959, but remained active in the international health community, for it is there that Dr. Soper stands out as one of the most successful practitioners of preventive medicine and public health in the middle 50 years of the 20th century. Following the death of his wife Juliet in 1968, and with his own health declining, Soper spent several years organizing his papers and writing his memoirs, working mainly at the National Library of Medicine in Bethesda, Maryland. Fred Soper died on February 9, 1977, in Wichita, Kansas.